we have an issue with teachers' medical cover, which is on the verge of collapse. You know, the teachers are covered by Minute, a company called Minute, and the government pays a whooping 15 billion every year so that the teachers can get their medical cover. For more than a month, the union has been receiving complaints from our members all over the country who faces difficulties accessing medical services, through the medical scheme that is provided by the Teacher Service Commission. As of Monday, 8th July, nearly all private mission hospitals accredited under the scheme and stopped providing services to the teachers and their dependents. Only public hospitals now offer services to teachers, yet there are too few and often lacks equipment and reagents for essential treatment. So as we stand now, the teachers can only access medical services from public hospitals. And you know, the situation in public hospitals are deplorable. You cannot get medicine, and even the process of seeing the doctors is also terrible. Kuppet members seeking medical services have been turned back from private hospitals and mission health facilities in such diverse regions as Vihiga, Nyeri, Nairobi, Mombasa. Many teachers have been forced to pay for services from their own pockets, while others are being detained at hospitals which have withdrawn their services for inpatient care. So you can imagine teachers going to the hospital and they are turned. They are supposed to attend to the students, but they can't do it when they are sick. So this one has really compromised the delivery of services and, of course, the totality of quality education. Whereas the government has paid whooping 15 billion towards this medical scheme, teachers are back to the bad old days of holding fundraisings to offset medical and funeral expenses. So today we are forced to ask for alambis. This is very unfortunate. It goes down to compromise the dignity of the teachers. Because about medication is about dignity. When you cannot afford medical attention, your dignity is totally destroyed. And these are teachers who are role models in the communities. Kuppet demands immediate reinstatement of the scheme so that teachers can access the services due to them as a matter of right. The TSC must also explain to all Kenyans why teachers are suffering despite the huge investment in the scheme.
The challenge is that the hospitals, because we have also talked to the hospitals, and the many hospitals we have talked to say they have not received monies from the Teacher Service Commission. So we are asking the Teacher Service Commission that when the teachers surrendered their, if you remember, teachers were paid medical allowance, so that it goes into the scheme, they actually surrender the responsibility of the provision of the medical cover to them, to the Teachers Service Commission, which then stands as the surrogate parent of teachers' medical scheme cover and care. And therefore, we are asking them to send those monies to those hospitals so that the scheme can become operational.